I'm a paediatrician out at the Children's Hospital at Westmead, where Josh was treated. I was previously a member of the research committee for Cure Kids New Zealand, so I have a very good understanding of how effective Vicky and her team are at raising money and supporting research. And of course I know personally the people who are supported in New Zealand and the work that they've done, which has achieved international recognition. Now, Australia and New Zealanders share a patch in the Pacific Ocean. We share a common heritage, and hence we share a lot of common genes, and that of course means that we share a lot of diseases and health issues. One of the concerns, of course, that we do have is that we're an ageing society, and that as people age, they have more health costs, and that takes away from children. And yet investing in a child's health means that we're really investing in a very long future. We really can't be complacent. We are lucky, but we still need to do more to help children. And one of the ways we can do that is by funding research. So what is the health of Australian children like? Well, we have a population of about 22.5 million, and about 19% of us are under 15, and about 2.5% are Indigenous. Most deaths occur in that newborn period, that very critical early few weeks of life, from malformations, as Vicky mentioned, infections, or prematurity and its complications. But we now have 37% of children with chronic illnesses, asthma, diabetes, cancer. When we compare ourselves with other similar countries around the world, we're doing pretty good with some things, and we've got very poor outcomes in infant mortality, largely because of those Indigenous populations I talked about, diabetes and asthma. So we really do need to be paying more attention to these conditions. So I would urge you all to think what does make life worthwhile, and it is really being healthy and having a happy life. And I think that research for children is a good investment. Research funding in Australia for child health is very hard to find. Last year, only 15% of over 4,500 project grant applications from the National Health Medical Research Council were funded. There are a few specific paediatric charities in Australia. And I would reinforce what Vicky said, that people are the key to successful research. You've got to put your money where the track record is, where the people are, and the projects will follow. So we desperately need Cure Kids Australia. And I urge you all to support this very worthwhile cause to improve the health of Australian children through research and its outcomes.